My name is Alberto Cifuentes Jr. I'm a rising third year in the PhD program at the University of Connecticut School of Social Work. And briefly, my research has to do with the criminalization and stigmatization of commercial sex workers in the United States, specifically the impact that criminalization and stigmatization has on their health and well-being. I knew that I wanted to do research that impacted policy and involved actual communities that I was serving. I've known that I wanted to do policy impacted and action-oriented work from when I was beginning as a social worker in my master's program. I was already a community organizer. I was organizing for the rights of and safety of vulnerable communities, specifically the LGBTQ community, undocumented immigrants, and I knew that this was my calling, and but I needed to find other venues and other avenues of trying to get to that. Well, how do I turn this research, this community participation, this information I'm getting, these narratives from community members, how do I turn it into actual policy change? And I thought this program was a perfect way of doing that, was another avenue for getting connected with other scholars who were doing similar work, as well as trying to connect with people who gave grants, organizations that really valued this work that I wanted to get connected with and that I could do more in the future. I really want to do community-based participatory action research, and I feel that this at the HPRS could really support me in doing that work. So last year, I got to go to the Sex Workers Project at the Urban Justice Center in New York City. And the Sex Workers Project is the only organization in the United States that actually helps those that participate in consensual sex work. So those are sex workers that non-coercively participate in sex work, and those that are trafficked, so those that are coerced into sex work. And it was the only organization that I knew of. All organizations are pretty much split into pro-sex worker rights or anti-sex trafficking. And I really wanted to see what work this organization was doing and the members who were so politically involved. So I'm really interested in social identity and how the collective label, the collective identity of sex worker, the political identity, really impacts health outcomes, helps improve feelings of solidarity, feelings of community building. And what I learned through this group in my research was that they are really not only politically involved, but they also, even in the wake of legislation that's very much anti-sex worker rights, they look out for one another, they bond with one another, they create avenues of safety and protection. And that's something that needs to be examined and respected, and not enough researchers are doing that. And that's something that, as a social worker, and as someone who looks at the bigger system, macro system, that's something that I really want to look at and respect and have the voices of sex workers contribute to. When I was first looking at the meaning of a culture of health, I think, like a lot of people, you look at it, well, it's preventing, it's about alleviating sickness. And it isn't so much about prevention, about, well, what are the actual factors that contribute to a culture of health? I think we live in such a reactive culture in society that we kind of looked only at the symptoms, at the diagnosis, and we don't look at what kind of culture, what kind of system contributes to that. And so as a practitioner and as a researcher, I really want to look a lot at prevention and access and how we can improve services for commercial sex workers, provide safer environments for them to report instances, for instance, of sex trafficking or abuses by law enforcement. Often they don't feel safe, and it often takes someone to either be murdered or abused in order for law enforcement to actually say there's something wrong with our policies and our laws, and this is negatively impacting sex workers. We shouldn't have to get to the point of just simply reacting. We should focus on preventing. And I feel that a culture of health really takes that into consideration. It's not simply about diagnosis. One of the things that I'm really looking at is access to social services and social programs for commercial sex workers. Often, sex workers are simply labeled as victims. They're not looked at as survivors. They're not looked at as people, whether they want to get out of sex work or whether they want to stay in sex work. They're very stigmatized, and they're looked at as second-class citizens, and they're discriminated against in employment, in housing, in healthcare. And that's something that I recognize needs to change through our policies. So in order to build a culture of health for this specific population that's been marginalized in our society, and that's kind of been it's been really marginalized, we need to, first of all, we need to destigmatize sex work, and we need to reframe it as something that can actually be liberatory. We need to reframe it as something that is actual work, and we need to decriminalize it and remove criminal penalties from those that participate in sex work and those that report abuses in sex work. And so I think trying to build that culture of safety and security amongst sex workers will really help other communities, especially the queer community and trans women of color who tend to be very victimized, either by law enforcement, and those that participate in sex work are also very much victimized because of their identities. And so that's something that I feel needs to be addressed when we're talking about a culture of health for this community. The word interdisciplinary is probably one of my favorite words in the English language, and that was one of the first words I noticed when I was applying to be a health policy research scholar. And the other word I think that comes very close to interdisciplinary is collaborative. And I am just so honored and privileged to be in a community of 40 other scholars who are in so many different disciplines, from more basic science to social behavioral science to economic science. My research is interdisciplinary, and in the future, I'm not going to kind of relegate myself to a box of I'm only going to be an instructor or researcher of social work. I do want to work with people from other fields. I think we need those other different perspectives and worldviews to really gain a more holistic perspective of what a culture of health can look like. And I'm so honored to be on the beginning of this journey to really realizing how I can create impactful research.